Can I begin by thanking our frontline staff, particularly our health staff, our doctors, our nurses, our paramedics, our cleaners, our O call operators, who every single day over the last 2 years, but particularly during this last period of time, are doing an amazing job and an extraordinary effort in keeping our people safe right across our state. It has been an incredibly challenging 2 years. Many people are tired, but our health system remains strong because of the efforts and the tireless work of our health staff right across New South Wales. So can I begin on behalf of all the people of New South Wales, thank you very much for everything that you do. The key point today is what has led to our success here in New South Wales has been our vaccination rate. And the efforts that everybody across New South Wales has made in going out and getting vaccinated has ensured that we've been able to get through this challenging and difficult time. I want to put forward today our continued effort that needs to be made right across our state to get boosted. We are seeing probably from 17 January we'll get up to around 300,000 booster shots administered per week in our 40 hubs alone. But once again, can I say, if you haven't been boosted and it's been 4 months since your second dose vaccination, please go out and get boosted. You can do so at your GP, at your pharmacist, or importantly, at one of our 40 centres across New South Wales. And as Susan Pearce will speak to, we also have outreach going out to regional and remote communities to assist in that booster shot program. Coming from Monday, we will have, as we've announced earlier this week, we will provide an opportunity for children aged between 5 and 11 to also receive the vaccination program, and that will once again occur in our hubs across the state, but also importantly for many parents today, you can also, and what would normally occur in the natural course, have that vaccination take place in your GP. So make an appointment from Monday next week, and that will ensure we continue to keep our kids safe, our friends and family safe as we move through this next period of time. Today, we will be releasing modelling in terms of the hospital capacity here in New South Wales. We move through this system. We've modelled 3 different areas over this period of time as pressure on the health system builds over the next few weeks. This is in line with what we did during the Delta outbreak. What is encouraging from this model is that even on a worst case scenario, we have the capacity in our health system right now. So obviously around the country, around the world, during this pandemic, we are seeing significant pressure on our health system, but our health system is strong. We've invested significantly. We have the best health system here in New South Wales in the country, if not around the world, and that is importantly supported by those great men and women who are making those efforts each and every day to keep people safe. And once again, I want to thank our health workers for that. In order to assist the health system during this period of time, just like we did during the Alpha outbreak and the Delta outbreak, today we are announcing that we will continue to suspend elective surgery for non-urgent surgeries. That's category 3, which is not elective surgery that's non-urgent in the next 365 days until mid-February, and also we'll be engaging with the private hospital system to help with capacity constraints over this period of time. We did that during the Delta outbreak and the Alpha outbreak, and we believe this is the right approach right now to help, as you'll see through that modelling. And Susan will obviously speak to those capacity issues as we move through, and following this press conference there'll be a detailed opportunity for members of the media to sit down with Susan and our health teams to go through that further. In addition today, as we've seen, those significant queues have eased in relation to PCR testing. We are making an announcement today that as we move to rapid antigen tests over this next period of time, we will be counting those positive RAT tests just in line and including them as we have with PCR testing. So what we would say to people today as we move through this period, that if you do receive a positive rapid antigen test, that you register that through Service New South Wales and New South Wales Health. New South Wales Health and Service New South Wales have been working on and will be available next week, by mid-next week, a system that if you do have a positive rapid antigen test, that you treat that as if it was a positive PCR test, and that you isolate in accordance with the rules that are in place. And Dr. Champ will provide some further information in relation to that. We will be seeing here in New South Wales from next week, we put 50 million orders in for rapid antigen tests. We expect them to be arriving early next week, and we will have something to say in the next few days in relation to the distribution of those rapid antigen tests in conjunction and alongside the distribution that will be occurring at the federal government level. Now, we've always said that as we move through this pandemic, we will continue to monitor our hospitalisations and ICU capacity. So today we are making some sensible and proportionate changes as we move through this next period as the peak, as the peak of Omicron comes through. And so those changes will come in from tomorrow up to Jan 27, where the other restrictions remain in place. Those changes are as follows. There'll be no singing and dancing in hospitality venues. That does not include weddings or performers or classes that people may be conducting. In addition to that, major events will proceed. This information out today. In overwhelming majority, major events across New South Wales will proceed. Health is currently reviewing those, and if there is deemed to be a high-risk venue, New South Wales Health, along with the Department of Premier and Cabinet, will work closely with organisers in adjusting those COVID-safe plans. So if you have a major event planned throughout January, continue as planned. There are no changes to any of those events. They are continuing as planned, only in circumstances where New South Wales Health deems that event to be a high-risk event. Then we will contact those organisers and work through the current COVID-safe plans with you. As well, today we are saying, as we have in the past, we continue to encourage people to minimise mingling where possible. If you're in a hospitality venue, if you can sit down while drinking, please do so. Minimising mingling during this period of time obviously provides a greater assistance across the board, and also with household visitations, please, where you can, minimise those household visitations. And as well, when you're having events inside, if you can have those events outdoors, we highly recommend it. Whilst it's raining today, it's been raining this week, we're in the middle of summer. It's a great opportunity to move indoors, outdoors, and that will assist as well as we move through this period. The other change today is in relation to, which will provide more information on as we move forward. The other change is in relation to mandatory vaccinations. So there are a number of workers here in New South Wales that we have deemed to be in high-risk settings. In those circumstances, we have mandated vaccinations. We will be moving to those mandates, including a booster shot. So the Health Minister is working through that at the moment, but that announcement today will ensure that whether it's our teachers, nurses, our frontline health and disability workers, where New South Wales Health has previously required mandatory vaccination for certain frontline staff, that we will move to boosters being included as part of that fully vaccinated determination. So can I end where I began, and that is thanking our health workers. They've gone through so much over a difficult period of time. Our health system, though, stands strong because of them and because of the substantial investments that we have made. The modelling today is encouraging. Whilst it will be a difficult few weeks in New South Wales, our people and the effort we have made to go out, to get vaccinated, to get boosted, has been key to opening up our society, to living alongside the virus. This is a challenging time, not just in New South Wales but around the world, but the efforts that our people have made has kept New South Wales safe, has kept New South Wales open and kept New South Wales strong. And if we can continue, thank everyone for their patience, particularly those who've had to line up in PCR queues and the like. We continue to be patient and continue to treat people with kindness and respect. Once again, we'll come out stronger the other side.